And when you have been in that low thyroid state too long, you are living on adrenaline and cortisone, which are destroying all of your essential tissues. I've seen many low thyroid people who in a day produced 30 or 40 times more adrenaline than normal, and adrenaline tends to lead immediately to cortisone production depending on how efficient your adrenals are. And this high adrenaline state creates a terrible amount of confusion among doctors and patients both, because as an adaptation, it makes people feel like they're on speed sometimes to have this adaptive extreme overproduction of adrenaline. And at night, it's normal for adrenaline and cortisone to rise even in young people because it's a sort of a fasting state, and they're not eating, and so they maintain these sugar-producing hormones during the night. But in old age, these are higher in general because of the low thyroid. So that if your thyroid is low or you're old and have low thyroid as a more or less natural thing, nighttime with the rising adrenaline and cortisone becomes more and more stressful, and insomnia becomes more and more common. It's very usual for people in their 70s and 80s to wake up after 5 or 6 hours of sleep and just get up early because they know they aren't going to be able to get back to sleep. But this also happens in very young people who have low thyroid. And when it gets to an extreme, it can lead to a hyperactive state with loss of attention or extreme irritability and depression and a lot of strange symptoms that if you can get your cortisone and adrenaline under control by normalizing your thyroid and blood sugar, these strange symptoms of high tension just disappear. One of the common stereotypes about low thyroid people is that they are just lethargic and sluggish, but a very large group of low thyroid people become hyperactive because of this very high adrenaline compensating for the low blood sugar.